Okay. Stand pivot. Who's going to be the volunteer? Have a seat in the chair. Same thing, you want to get it at an angle. If you can't get it at an angle and you're this way, that's perfectly fine. You just have further to go. Okay?
So this one, you don't have to take that off.
You do not,
Okay.
because we're not worried about that getting in the way. I would say this, if you got somebody and they feel like they can get to here and then they can't, you might want to sit them down and take off that armrest, because now we don't have to clear this. All we have to do is clear this. So if they can do a stand pivot, and all you need to do is clear the table with their bottom.
MRI safe?
MRI safe? No. That one is.
Oh,
So you could leave it on. This is the belt you're not supposed to use because it's cloth. That's why I use it. So same thing. Can you lean forward for me, please? And lean back. Obviously, the person has to be able to stand up to do the stand pivot transfer. So if they can't stand up, you can't do it. Snug but not tight, correct?
Mm-hmm.
You never, ever, ever let someone grab a hold of you up here. I see caregivers doing that all the time. What's happening then is you're using your back, okay? So you're gonna stress your back, you're gonna stress your neck. So never, ever let them grab a hold of you up here, okay? I let patients grab a hold of my waist, but that's not my preferred position. My preferred position is my arms. Because if they hang on to my arm here, I can guide their arms away from me if I need to. I can pull them in if I need to. I have more control here. So I always have my patients grab a hold of my arms. Once again, I want to put my foot between theirs. I don't always do it this way. Sometimes I'll do it this way, but I choose to prefer do it this way because then I can step out of the way and I'm clear to step around. If I'm over here, then I'm over here. I just don't feel as comfortable. It's a preference for me. So then what I want to do is I want to find out, do they have one leg that's stronger than the other? Because if they have a strong leg, then I'm going to block that leg. If they've got two legs that are weak, I'm going to make a choice what I want to do. But I can take my foot and my beside theirs, and I can put my knee beside theirs, and I can hold them here. And this way, they can't slide out of the chair, and they're not going to collapse on me because I'm holding them. And I'm at an advantageous angle because I'm bent and I'm pushing against them. But it's not uncomfortable, is it? So what you're going to do is you're going to reach up here and grab a hold of my arm right there. Same thing with the other side. And then what we're going to do is on 3, we're going to stand up. I want you to lean forward. 1, 2, 3. And I am stand up. Okay? And then at this point, I'm going to step out of the way. I want you to move this foot that way. Keep coming, keep coming, keep coming. Now I want you to sit down. And I'm going to grab her knee as I go back down. Okay? What you might not have seen is my foot's in between and I go, I want you to move that foot. And then when I kick my foot, I have them remove the other foot. And I'm telling them where I want them to go. I want you to go this way. So I'm giving them verbal cues and I'm giving them tactile cues. Okay?
So the belt stays on all the time? Or what if,
If you're using that belt, it would, because that's, I believe, MRI safe. I believe.
but it won't have, it won't show artifact for the x-rays?
I don't know. That's not my
I
specialty.
mean, it wouldn't hurt to just take it off, just to be on the safe
Yeah.
side.
It's
Because
better.
it might attenuate.
Yeah, and that's something you'll have to check out.
Well, I'm just saying, because then if we take it off, then we have to.
And that's not a big
shove it
deal.
back on again.
That's not a big deal. When I was working in the hospital doing patient care, I always took it off when I got to the position I wanted. And my hands are on either side of her, not out here in front. I'm not doing this, because I have no control. Can you imagine if you're holding a weight and it's going back and forth like this? Or it's just that you have the weight here. Now the only way she can go is back and I can pull her. If she's coming forward, I can push her. I got this side to side. Okay? Do me a favor. I want you to stand up for me, please. Step out a little bit. Let's just get this here. Now what I want you to do is I want you to bend your, like that. Now, try to squat. Try to squat. Go ahead, try it. Can't, can you?
Nope.
And I'm not even budget. So I can really support her really well if she starts to give out. Okay? Grab a hold of my arms. Now, what you'll have sometimes is patients will let go right in the middle, let go with his hand, and I'll say, please grab a hold of my arm. That's it, grab my arm. Hang on to me, don't let go. Because if they let go and they want to reach for something, it's going to be my shoulders, there's going to be that table, and that's going to shift their weight over. Go ahead and reach down to the table over there. See how they want to fall that way? And now I'm having to work hard to control her here. Grab a hold of my arm.
Back.
Grab a hold of my arm. And now I want you to sit down. And I sit down with her. So I'm getting my body in the right position as well. Matching hers as she goes up and down.